Small group.
Yeah, it is a small group. I knew it was going to be small, but this is very small.
You think we come?
Hmm?
Do you think Lee Butler's coming?
I'm hoping so. Well, I guess we can get a lot done if there's a small group.
Probably can.
Linda, can you hear us?
I can hear you.
Okay, great. Thank you.
I'm just eating my lunch and I didn't want to like
Oh,
be shovel in my face. Yeah.
No worries. I was just testing the sound. Thanks, Shannon.
If we don't have any sign up. Outreach, it's kind of sad. Yeah, exactly. 6 months from now or something.
Did you hear from Lee? Is he supposed to? I didn't hear one way or the other.
So have you been to the coast lately?
Have I been to the coast? We're about to go to the coast next month for a week and a half or so.
Yeah, good.
You know, we're in the seaside.
You enjoy it when you go there? Is that somewhere you like to be all the time?
Yeah. My in-laws have a here.
That's right. Well,
Condo.
that's what you said.
Yeah.
Zooming in.
No work this time though. Last time I think we were over there, I was painting the place. This time I was just gonna be lazy.
Relax.
Yeah.
You don't do any surfing over there, do you?
No. I watch them. Yeah, that's not a thing. I don't think that's a thing for a guy.
Lunch, I should have just had that salad. The salad was good.
There's Lee.
I just jumped into the freezing Deschutes River.
Oh, boy, Pines, yeah, that's coming up.
It's coming up.
March, they moved it to March 1st.
March 1.
How's it going?
Okay, I think that we'll get started here. It's a little bit after noon. You guys all know me. I'm Melinda Thomas, and we have Roger that's no longer on the board or as an officer, and then Jessica Vieira stepped down a couple months ago from her officer position, but we've subsequently gotten notice that she is stepping off the board altogether. And so I'm stepping in just to preside over this meeting to try and get us started. We probably got some organizational things to do. So I just wanted to say hi and welcome, and thanks for indulging me if I muck this meeting up, but I'm going to do the best that I can. I spend a lot of time at school board meetings, so I'm kind of maybe a little bit more formal than you guys are used to, but it's just all I know. Anyway, I hope you guys had a great December break from this and good holiday season. The first thing that we need to do, I think Dana sent out a copy of today's agenda and as well as the November board meeting minutes. Have you all had a chance to take a look at those? Do you have any discussion or thoughts, revisions that you think need to be made? Anybody like to make a motion to approve the November 2024 board meeting minutes?
I'll make that motion.
Second. All right, any further discussion on that? All right, let's take a vote. All those in favor say aye.
Aye.
All those opposed? All right, so that carries. Easy. All right, so Holly Harris is not here to give a director's report, but Paul is for her. And I think, Paul, you have some things that you'd like to update us on?
You. Wow,
We might be down to the second string today, huh?
Huh?
You chairing and me covering Holly, that's a tall order to cover Holly. I am not going to attempt to give you what Holly normally does in a director's update, but she did, I want to draw board members' attention to the email that Dana sent out yesterday, Wednesday. It has a very nice synopsis that Holly has put together of the 2024 accomplishments. So I'll just let you look at that, and then I think she has invited folks to ask her directly if you need clarification on any of the summary that she has shared. And in that, as a way of transitioning into what I have to share, I have passed around a one-pager, but one of the things that Holly has included in this summary in terms of on the horizon or looking forward is a project that I have been heavily involved in partnership with her. What you have in front of you, and for the folks online,
I just sent that to them.
Dana has sent it to you via email, so you can have this as a reference. But we're really excited about this, and I should give the disclaimer that we have yet to go to the Board of County Commissioners on it. Commissioner Adair is aware of it because we had a one-on-one with her, and we will be going to the board formally next week. Talk more about this project. But what it is a combination, it's a IDD, Intellectual Developmental Disabilities residential program. And it is going to be in collaboration with mental health. We're going to be utilizing some funding that Holly's been able to obtain through House Bill 5202. And I don't think I can answer any questions about the source very well of the funding, but it was some funding that was awarded, I think actually a couple of years ago, really to try to divert people from Oregon State Hospital. And this is a population, folks with IDD, adults with IDD who have co-occurring severe and persistent mental illness. Studies show that about 40% of our population have a co-occurring mental health condition. It's very under-recognized, and there are folks in our own community that we typically are faced with having to find placement outside of Deschutes County because we simply don't have adequate capacity here. So this project would be looking to expand that, and the strategies would be that the county would purchase and then remodel a residential home. We're looking in the Redmond area. We have a property in mind, but I'm not going to disclose it until we talk to the board about it. But we have a property in mind that would have a capacity to serve 3 to 5 individuals. We would then solicit using a request for proposal, RFP, to all of the 24-hour IDD residential providers throughout Oregon to respond to operate that home. There would be a lease agreement with the county who would own the property, and we would be looking at a below market lease agreement with that successful provider. There would be some community outreach as a strategy to make sure that we have community engagement to understand the nature of the project. And then one of the most important parts is the partnership between our community mental health outpatient programs and the successful provider, so that we can integrate. Well, one, we have a rapid pathway toward outpatient mental health service for the residents of the home, and that they're able to have an accessible way of getting treatment, and that there is integration between the mental health treatment plan and the IDD individualized support plan. So they really are in lockstep. That's one of the things that has been missing in terms of serving this particular dual diagnosed population. So that's kind of the gist of the program and the outcome. As you can see on this one pager, the outcome that we hope to achieve is that residents of Deschutes County who experience an intellectual developmental disability with a co-occurring mental health condition have their residential support needs correctly met within our community. One of the things that happens, I want to just do one little plug, Mythbuster, if I can, since I still have the floor, is a lot of our community partners feel that the thing to do for some of our really tough to serve folks who have IDD and mental health severe behaviors is to send them to SACU, which is a state-operated stabilization and crisis unit. In my opinion, I'm stating my opinion because I've been in the field for over 30 years. I've watched how those state-operated homes work and the outcomes that we're able to achieve or not achieve for folks. And I feel like, the term stabilization, pulling an individual out of their home community and sending them across the mountains doesn't do anything to stabilize a person. They're not getting mental health treatment. Usually there's a co-occurring mental health condition for those people. And SACU does not provide, it's not residential treatment. It's an IDD licensed home and community-based setting, just like any of our other home and community-based settings. They just happen to be run by state personnel. But it's not cutting the mustard to upset, pull a person out of their home community, send them to a new one, try to establish care with a primary care physician, a psychiatrist, what have you. And then the idea is they're supposed to get stabilized and then step down into a more long-term placement back in their own community. And that generally creates a new disruption and a need to re-stabilize. So my argument is we need to find ways in our system to correctly support people within, as our outcome statement says here, to correctly support their needs in their own community in the first place. So we can avoid the whole moving again kind of a thing. So I'll gladly take questions.
Right. First of all, yay, that's awesome. So excited to hear this. So thanks for your work on that. Two questions. One is just a clarifying. This is a long-term residential. This is not, okay. And then with serving 3 to 5 individuals, what would you say, Paul, that is percentage-wise of what we need for this population in Central Oregon?
It's a fraction.
It is.
And it is, it's probably about 10% of what we need.
Okay.
And one of the other outcomes I'm really hoping for, so let me back up a little bit. It is a long-term, it's a home and community-based setting under Medicaid, which means an individual has choice to remain there as long as they, want that setting. That's part of our service delivery. We hope to treatment teams would be encouraging people to work toward a more independent, setting, but we can't compel that. So what we're really hoping is that we're able to demonstrate as kind of a pilot, using, this as a seed and a pilot, that this is something that can be reproduced and we can scale it. We can encourage our IDD providers to open up, new settings with similar partnership with mental health.
It's fantastic, great.
And the really exciting thing to me is the commitment from Holly, our behavioral health director, that this is the thing that needs to happen. This is a population that needs to be correctly served. And she's, she can give marching orders to, to everybody to say, hey, you got to do this. Prescribers, outpatient clinicians, you need to adapt the way you're doing things. And so, yeah, I'm super excited about it.
So what you're saying though, these folks, in lieu of this operation, more likely they'd go to Oregon State Hospital?
Well, potentially. Yeah, it's tooth and nail to ever get any of our folks into the state hospital, and I wouldn't propose that that's the correct place for them to be anyway. But that's the effort that we're trying to divert is that they would be in a setting like OSH or any setting outside of our own community.
Yeah, the only thing I see when we talk about OSH and local, I think it's great for the patient to be locally, but I do see many times Oregon State Hospital, it seems to me that they do a really good job of trying to push people out of there. And I do know one of the things about Oregon State Hospital, when they do go there, the care is tremendous. We see change in behavior that we've never seen before.
Mm-hmm.
And I have witnessed as a police officer in some of the things they do, and I don't understand it, but I just see care matters, services matter, and if it's not good quality service in a location, then we're just part of that circle again. Anyway, that is a perception I have regarding. I do enjoy the Oregon State Hospital. I've been there, I've seen people, and I know many of the folks that work there. And their care is tremendous, but it's expensive and it does pull people out of the community.
And I think in the 6 years that I've been over here in Deschutes, I think I've yet to witness an individual with IDD actually get hospitalized at OSH. So I don't even look at OSH really as an option for our folks.
Right.
Just it hasn't been accessible.
I don't have a way to raise my hand, but this is Linda remotely. What kind of staffing might you envision? And I guess it's going to depend on the diagnosis and whatnot. If you had the 3 to 5 people in a residential setting, what kind of staffing are you looking at? And would it be a different model than the foster home model, professional paid staff that rotated in and out, or have you gone that far with it?
Yeah, the staffing would depend on the assessed needs of the individuals, the residents of the home. But the model is a IDD 24-hour home, Linda. So similar to the group homes that are currently within Deschutes County that are operated by Opportunity Foundation or Central Oregon Collective. Those homes are licensed as a 24-hour, and they have shift staffing that rotates on a 24-hour basis. So you don't have a sole proprietor, or a ma and pa situation like you and Carl, who are getting burned out and trying to, scramble to find substitute caregivers. It's a 24-hour model with shift staffing.
It sounds amazing. I'm so glad this is happening. Thank you.
Anything else for Paul? That is encouraging.
Yeah, we'll keep you updated as things progress on this. It is an exciting project and there's going to be a lot of steps. One of the questions I've been asked a lot is timelines, and I don't have answers for that, so I'm glad nobody asked it. But I would at least mention it's going to be dependent a lot on contractors and getting a property, rehabilitated appropriately to work for this project. So more to come.
Thanks, Paul. And as I told you guys, I was going to muck this meeting up, and I went right past introductions. I think most of us know each other, but there's some people that I'm not very familiar with. So I am going to backtrack up and ask for some introductions, particularly on the people online. And so again, I'm Melinda Thomas. I'm an attorney with the High Desert Education Service District, and I do a lot of special education advising to school districts. And so that's the basis for my interest in behavioral health.
I'm Julie McFarland, small business owner. I have a family member who did take advantage of Deschutes County Services, and I'm a board member for NAMI, Central Oregon.
Amber Clegg, I'm a clinical program manager here at Deschutes County Behavioral Health.
Lee Butler, I'm a clinician at Ben Treatment Center, the methadone clinic in town, and I have a family member that uses services.
Michael Schultz, and I work for the Deschutes County Sheriff's Office.
Paul Partridge, and I'm the program manager for the IDD program here at Deschutes, and acting for Holly today, the last day. I'll be back next week.
Peter Murray, the administrative assistant for behavioral health at Deschutes County.
And Jess Woodmansee, the administrative assistant for the operations team on admin services.
Cameron Fisher, board member.
Danielle McBain, board member, have a child that accesses both IDD and mental health services.
So Linda, you want to go? We're going to switch to the online folks.
Sure, thank you. Linda Nolte, my husband and I run an IDD, actually dual diagnosis home. And we've been doing it 13 years this April. And I'm privileged and glad to have been accepted into this committee newly, and I'm trying to learn as fast as I can.
Shannon.
Hi, everyone. I'm Shannon Brister-Ragas, program manager with Deschutes County Behavioral Health. I oversee comprehensive care for youth, families, and young adults.
Peter.
Peter Bohm, retired pediatrician, board member, and I have, in 40 years of being here, I've never seen anything remotely like the program that Paul told us about. I'm absolutely amazed. Nice work.
Kristen.
Hi, Kristen Mizaki. I'm a program manager. I work with the adult outpatient teams and our two hubs, one in Redmond and one in La Pine.
Stephanie.
Hello, I'm Stephanie Etzman, board member and parent of a young man who receives services.
It looks like we've got Callie Rumley.
Hi, everybody. My name's Callie Rumley, and I work at Pacific Source on the Behavioral Health Population Health team. And apologies, I'm traveling between meetings, so camera off today.
No problem. And then good timing. We just had a very special board member walk into the room. So can you do your introduction, please?
Oh, me, just Lorelei, ex-board member, concerned citizen.
Awesome. All right, thanks everybody and for indulging me on that. So the next item on the agenda, I assume you guys all have a printed copy of the agenda, is the appointment of officers for this board. I know that Roger back in like the November timeframe was asking people to let him know if anybody was interested in assuming an officer position. I don't know that he got a whole lot of feedback. No, Dana, I don't think that you really have either. We have to fill the chair position and we have to fill the co-chair position. And then we'll talk about committees a bit later in the agenda. And so as far as the chair position, I'm willing to step forward and play that role if you guys are interested in having me do that. But I do want to say I'm already a member of two committees and I probably don't want to do the chair position and the membership onboarding committee and the letters of support and advocacy part, but I will throw my name into that. And then I think we might have somebody that might be interested in the co-chair position. Is there anybody else that is interested in an officer position?
I'd like to throw my name in for that co-chair if that's available.
Great.
Can I just make a clarification? Is it vice chair or co-chair?
It's co-chair.
It is
It is
co-chair.
co-chair under the bylaws, yeah,
Okay.
it is. Is there anybody else that wants to throw their name in or make a motion? I would suggest that we make a motion separately for the chair position and the co-chair position. But
I'll make a motion to
Elect.
elect Linda for the chair position.
I'll second that.
thank you. Is there any other discussion about that? It's the time to throw tomatoes at me now if you want. All right, we'll put it to a vote. All those in favor, and I'm not going to vote for myself. I'm gonna withhold that. So all those in favor, say aye.
Aye.
Okay,
With that, unanimous.
all right, motion passes. Okay, so now I'm actually legally running this meeting.
Thank you.
All right, and then Lee has offered and put his name forward. Any discussion? Anybody else interested in that position? Any motions?
I'll motion that he is here.
I'll second.
Any other discussion? Opportunities to throw tomatoes at Lee?
Luckily, tomatoes are well out of season,
These are really good and juicy now.
at least locally.
All right, we'll put it to a vote. All those in favor of appointing Lee Butler as the co-chair position for BHAB, say aye.
Aye.
Any opposed? All right, the motion carries. All right, you have officers.
We have a
50/50s.
All right, so as your new chair, we have our next board agenda item, which Lee and I haven't even had a chance to discuss any of this. But it feels like we're kind of on the precipice of a new year, maybe doing things slightly differently, different styles, whatnot. And so I do think it's worth opening up a conversation among this board about what our priorities should be, what strategies we might want to adopt, what our intentions are. Because to be quite honest, my first year on the board, well, my only year on the board, you know, a lot of the meetings we heard from speakers, but I don't know that, I didn't always feel like we were walking out of the meetings feeling like we are doing something. We're more learning and it's coming our way. And I'd like to kind of change that direction a little bit and have a little bit more of an impact on the community if we can. So I just wanted to throw that out there and find out how you guys are all feeling about this board and directions that it should go in, keeping in mind what our RAC card mission and all that is. So I'd really like to hear from you guys.
This is Linda, and I'm really new, and I found myself asking the same questions. And when I looked at our brochure, because I have so little experience with this group, I realized that as a member, I want to understand what everybody else does so that I can then do what I think I'm interpreting the brochure to say, which is to make sure that the people in the community who need these services know about them, number one, and know what the path is to receiving what they need, what I'm interpreting. And if that's my interpretation and I'm dead wrong, then I think I agree that we need to be more clear about what we're doing. But that's what I think we're kind of trying to do.
I would say, I think that a combination of both is nice in the sense that as a parent who has tried to access services, it's extremely hard sometimes to actually know what exists. I can't tell you how many phone calls I get personally from child psychologists in town and family members, friends of friends who say, Danielle, what did you do when you were going through this? So I think for us to understand what's there so that we can do exactly what Linda just said, make sure the community knows, because it's always felt like it's some super secret thing to figure out what services your loved one can get, and that's a challenge. So I love maybe the advocacy component and doing more. I fully believe in that, as long as we also know what's available.
It's hard to advocate if we don't all know what's available. So.
Yeah.
So if I could jump on that, and when it comes to the committee membership, since I'm kind of on the community outreach, which is the wrong term, I think, for it, I was going to talk about that in a little bit, but for me too, both as a parent and then as a NAMI board member, I get phone calls at home saying, you know, where should I go? And you'll see, I'm gonna pass this around. I'll start it around anyway right now. That I'm starting to contact these kinds of organizations and set up these little meetings. It's going to be every other month. If you can go, great. If you can't, or you don't need to go, or you've already been, or you're not interested, or it doesn't work with your schedule, it's no big deal. If one person or two people show up, that's absolutely great. I had a really nice conversation, and I'll do that later, with Shepherd's House Ministries yesterday. And it was my opportunity to tell them who we are and what we're trying to do, but also educate ourselves. I've actually never been in Shepherd's House. So my thought would be, it sure would be helpful for me as a board member. I will get something out of these kinds of meetings. But yes, I think that's an important part. And I think we're going to cover that. So when that does go around, you can just get started on it. Put a check mark by one, as many as you want that you would be interested in hearing about or learning about more, or write something in if I've missed a organization that you're like, oh, I'd really be interested in going to that one. And then I can see where the interest is and try to set those appointments up first. I'm always trying to set them up at the end of the day kind of thing.
So this is Linda. In a previous life, I worked with lots and lots of for-profit, not-for-profit company, blah, 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 organizations, and helped guide the process of defining what is our vision, what is our key strategy, what is our mission, and then how we align our activities to those so that it's all lined up instead of scattershot. And I would be willing to serve this group if we wanted to spend more than one session, which probably we could without making it too complicated, just to lead the conversation using, my training in that role. I'm not saying we should make it harder than it is or that I would have answers, but if we need to get more intentional about that kind of process so that it lives for multiple years, and then we can make our decisions of where we spend our resources based on what those more strategic intentions are. If we don't need it, we don't need it, but that's a little bitty role I could serve without having to have a lot of experience with the content if anybody's interested.
Thanks, Linda. Anybody else have thoughts?
I don't know the answer to this, but I guess I get a little concerned about the role of the advisory board. Does that include outreach? And I guess I don't want to step on the toes of county employees who are doing their work and duplicating. And so I guess I'm trying to understand how to navigate, because I totally agree that it is really hard for families to find services. However, I don't know if that's the role of the advisory board to be bridging that gap, or is it the role of county employees to be doing that? And maybe Holly's the person to speak to that. I don't want to step on folks' toes and also, reinvent some wheel.
I think that makes sense. I'm a little bit confused by all of that too, so.
I would offer, I think it might be both, but it from my perspective, it ought to be in lockstep. I mean, the outreach efforts the county staff are endeavoring, and the outreach efforts that the advisory board might be after should be, if not in unison, at least in the same key, right? And so, I mean, the other thing I was if I'm just going to speak up, maybe it'll get back to Holly and she'll not let me cover her again. Kristen or somebody, but, and Kristen, maybe you want to chime in on this. I mean, I think, behavioral health is engaged in a lot of system improvement activity in terms of clinical vision, and there's a lot of rule changes that have happened that have really opened up how we can go about delivering behavioral health services. And I would also offer, I mean, I think from staff perspective, what I think we would like too from the board is the advisory part. How do you all as a community, our community, how do you want to see us operating? So where we have opportunities, I think, because a lot of what we do in behavioral health is governed by rule and statute, and we have to do certain things a certain way, but we have opportunities to also gather input from our community, and I think that's a critical role of the board. Would you have anything to add? Not to put you on the spot, Kristen.
Yeah, I mean, I think it would be really helpful to bring some of the the questions and as we're making decisions through the different projects that we're working on and the larger kind of change process that we are just beginning, if they're, to share that, first of all, here with the board, and also to get feedback and input and maybe have some questions. Because I think your perspective will help us see some blind spots and some areas that we aren't gonna be able to see, or I think we overlook a lot of things sometimes. So I think that having the board play that role, particularly with all the work that we're doing right now, I think would be enormously helpful. So yeah, we have a lot of projects, internal projects, to help improve our access for clients, for the client experience throughout all of the programs within our organization. So sharing that with you and getting your input and feedback would be, I think, really a great place to start.
Thanks, Kristen.
So maybe the advising piece that we're doing in here is advising for, or sharing our hopes of better outreach and better information sharing and better increased awareness. But I don't know if that's, again, going back, I don't know if that's the advisory board's role, or is that how do we help increase capacity for folks to be able to do that as part of your work base? And is that going back to, we advise the Board of County Commissioners and or Patty, our liaison with that?
I mean, I like exactly what you said, actually, is what I look at it more of a narrow purpose. One of the reasons why I like being on the board, and it's in our purpose. It says to bridge the communication advocacy through the community to the Board of County Commissioners, because they're our stakeholders. So many of you have all the lived experiences. Behavioral health will come up with all these whiz-bang new programs, new things. And the sheriff's office are dealing with many of the individuals that when they fail those programs, we deal with them. It's the lowest level, and it's the root of failure is what we get. So when we have an idea or a program or information based on our expertise being on the advisory board, because we all are all expertise of the information, then we can advise. Like Patty's normally here. She's normally great. And she's a good advocate for us. But when the community meets and they start hearing these things, well, she's got one expertise area that she's been listening to, so she can manage that, or if there's money, she can send the right way. If there are systems that are not working well together, then we can advocate for those systems to work better. And there are failures in communication between systems. We do a good job here, though, but we just don't want that to happen. That's how I see it. And
Peter?
Well, one of our jobs is to advise the county commissioners as to what's going on. And it has been everything from being totally ignored by the commissioners to having Patty here and engaged in reporting. But I wonder if we shouldn't approach the commissioners and say, do you guys want a regular report from us about what we think ought to be going on, or supporting the behavioral health community, because they hold the purse strings and they do a lot of deciding about what can happen in mental health. So I wonder if we shouldn't chat with Patty about what time of the year would it make the biggest difference that we can critique and support what's going on in behavioral health.
Thanks, Peter. I love that idea.
I love that idea.
Yeah, because I've been confused in the year that I've been on this board that Patty comes to our meetings, and so I guess I've assumed that she's the liaison going back to the Board of Commissioners. And I know that now that we're expanding the board, the organization might change a little bit. I don't know what that impact is, but I am confused about, like, do we have a role? And we're talking to Patty, and I think Patty's awesome, but I'd also like to hear from the other 2 members and then soon to be 4 members, additional members too. Because it does seem like we're kind of in the middle of, we're a liaison, we're doing a lot of things. And so I do think that there's some work that we can do in the coming months. And in my opinion, that ought to be a priority so that we are as nimble and as effective as we can be. And so that's my bias, is that I'd rather do the work internally and kind of figure out what exactly we're doing and get ourselves organized like this. I don't know. And to be fair, Lee and I are going to need to sit down and talk. And I think that we'll have an appointment with Holly and, the program managers, and hear from them directly and kind of say, because it does occur to me that, when Holly's here giving her report and her boss Patty is sitting here, I don't know if there's any kind of a chilling effect. I don't think so, but you never know. And I'd just like to hear, what does Holly want us to do differently? Is there another way that we can be of service to behavioral health?
Oh, go ahead.
Yeah, I mean, it brings 2 points across the gap, right? Like, I know what the county brings. I don't know what the commissioners want or do need, and clearly, right? Not that, and that define expectation, understanding from this side of the bridge, using the imagery, would help. It's quite obvious with Holly and everybody coming in. We know that this is what we're working on, this is what we're working towards. This is how you guys can help us with going out. We're hearing our presentations, kind of feedback. Really well understand what half of that bridge looks like. And I agree that there's, a lack of orientation to the compass of what action we want to take as members, whether it's letter writing and who, what, where we do that, or what events we go to that are not being awkward in a tent that's not actually ours, and doing something that gives us coming here, not just that our time is valuable, but supporting and getting their voices heard. That's all value too. It's not a waste of opportunity. There's a few things I think we can plan out and organize for sure, but it would help that sort of structure, because I see value in both. Having people come in, us going out, I really like the direction. We need to support integration of the regional health plan. We've never talked about that except once or twice an announcement that we're doing RHA planning this month as like a passing statement. Like, I think that's a place we could find action within our professional or personal roles to meet some needs while figuring out this greater sort of, what are we doing? So I agree, exploring, figuring it out for the first couple of months is a good path.
So back to board priorities. To me, it seems like since we've lost some key figures and a few bodies, we need to think about bringing some new people on to fill the board again with some new members. But what I would like to suggest is we get some people who, some real thought put into who those people are and what they bring to the table. And then that kind of segues me to having tried to navigate the system years ago and just hitting roadblock after roadblock. As I sit in these meetings, Deschutes County Behavioral Health, Deschutes County in general is very well represented here. But I'd love to see High Lakes. I'd love to see Summit Health. I tried to go through the private practice and I lost 3 years because I was hitting absolutely every door was closed to me, and I thought I was doing it the right way. It's only when I heard about Deschutes County and some of the offerings that, we started to get some traction. But I don't believe there's anybody from any of these large medical organizations, not counting like a Pacific Source, of course, that's insurance, but where is Summit Health? Where is
I work for Mosaic.
Okay,
So,
yeah.
So
and I know Mosaic's involved actually.
Yeah.
But it would be nice to have a couple of those people represented here. And then that would change the whole conversation a little bit. And they would be, you know, I know this is a Deschutes County board, but wouldn't it be interesting if they provided some of their input? So I think a priority needs to be getting some new board members. And then I also think a priority needs to be these committees. And we've had like 4 committees. I think until we get the right people interested in being a leader of a committee, maybe we don't need 4, maybe we need 2 or 3 really good ones, and then we can always add other committees later and prioritize getting the board back to a full group, and then, you know, deciding which committees. And I know there are some committees that we know we need, but that's my thought on priorities.
Christina Lee was from St. Charles. She's
Yeah.
off now, and I think that there is somebody of interest, Molly Wells.
Molly Wells, darling, yeah.
Yeah, and so that'll be, she's interested, and so we'll have to get the onboarding membership committee going here fairly quickly. But there's that. So, and I think we have maybe 1 or 2 other people that have expressed an interest in joining the board. So that's
great.
That's good.
Can I? Okay, it's perfectly fine to say no. Can I share, even though I'm not a board member anymore? Okay, just as somebody who's at all the commissioners' meetings, it's not that hard to get on their agenda. And you also to reach out to them. I see people all the time having, and groups even having private meetings, well, private, they're posted and they're at the county administration building. I mean, I'm sure we could have something like that, or our own little, whatever you want to call it, a retreat or something where you could have some interaction and stuff. I'm just saying. And also at the beginning of every meeting, anybody can share for 3 minutes. So that's just an open invite if anybody wants to go and just say, hey, where you know, whatever. And they do listen. Well, it's citizen input, and they love that. So just saying.
Now that we have our 2 elected,
Cameron's up, and then I see you, Linda.
elected officers here, I just wanted to share a couple proposals that a few of us talked about in the past. And maybe this could be one of our, on our list of priorities. One, rotating commissioners on occasion to visit this board. 2, doing a collaborative meeting with a FAB, because I think Laura and I talked about this of, you know, like great things that they're doing and ways they're approaching things when they feel like they're, maybe Peter, you can speak to this because I think you're still on the FAB. Yeah. Okay.
What's the FAB? What is it?
Dr. Bone.
He was the one who was giving us this idea.
Yeah, I remember some of it.
Well, I
What
had
does the acronym stand for?
Public Health.
Public Health
Advisory Board.
So it's kind of like this, but the other wing.
Mhm.
Something like that, and hearing kind of how they're handling, sometimes feeling like treading water. And then another, I can't remember who was in the discussion about this, but maybe requesting from our liaison, from Patty, maybe on a monthly basis, bringing some takeaways from kind of several of the county commissioner meetings on what we could help advocate for. Just a little cheat sheet for all of us, from, not necessarily from Holly, but from the county commissioner who's kind of in the thick of it and there every time, can kind of loop us in, which I think is the vision of a liaison. And also, I think a lot of us are chomping at the bit of how can we help to advocate. I mean, the youth facility, the residential facility is like one that everybody has been for years been asking, what can we do? Where can we sign? How can we be big proponents? For a long time. But so I think those are some things I'd like to throw now that we've got you 2 in place, and to and maybe getting a little more on track before we do recruit new members, because it is hard for me to explain who we are. Yeah, I mean, because I think so. Getting some more clarity, and again, I don't know how to do all that, but those are some things that I think would be helpful in this board.
Linda?
Yes. So I decided to Google the definition of behavioral health. And it wasn't very helpful because it was page upon page and it varies. And we're the Behavioral Health Advisory Committee, and maybe I'm oversimplifying, but what I thought I heard our new chair ask was if we're the Behavioral Health Advisory Committee. Maybe she didn't ask that, maybe I'm imagining it. Can we explain what behavioral health is to anyone? Can we explain it to ourselves? Or is it currently a list of agencies and activities? And what is our glue in 15 words or less? What are we advising if we're advising behavioral health? I mean, so many things sound attractive and fun to do, but can we go back to a common sentence that says, if we do activity A or activity B or this this program or whatever, how does it link to these 15 words that tell us what behavioral health is that we're supposed to be advising to?
We used to be called the Mental Health Advisory Board.
So behavioral health just incorporates more than mental health. Then there's the IDD component, there's the substance use component. So it's all under behavioral health.
That's helpful context. Thank you.
Put in the chat the definition that Oregon gives us for behavioral health, which means spectrum of behaviors and conditions comprising mental health, substance use disorders, and problem gambling. It is much more than that, but that is the Oregon's definition of behavioral health. We are a CMHP, community mental health program, and we're required to have a behavioral health advisory board. And so that might be more helpful in understanding what our role is as a community mental health program. And those, again, is defined by Oregon as to what our roles and responsibilities. That branches out into Paul's area for developmental disabilities. And then Deschutes County Behavioral Health is pretty broad, but our licensure is for specific to behavioral health, IDD, and substance use. Kristen, Paul, did I get that right, or anything you'd add?
Shannon, that is a really intriguing idea to me because like Cameron said about collaborating with PHAB, if this is a statutorily required board, then that means we're not the only county that has this. And I'd like to know, what other counties are doing and how they structure themselves, how they prioritize, their activities. Do you have that statute handy? Because I'm a lawyer and I have to ask for statutes. I can find it. It's not a big deal.
It's yeah, I mean, it's chapter 309 of behavioral health services. It's pretty broad.
Okay, I can find it there. That 309 helps.
Yeah, and then I'll just put this is an AI definition, but community behavioral health in Oregon, I'll just put that in the chat too. But that might be helpful in understanding kind of, to Linda's point, like, what does this mean? What does behavioral health even mean?
Okay, thank you.
And I think the state.
Yeah, community behavioral health goes further into like the inclusion of developmental disabilities, but the goal is to help people achieve physical, mental health, and social well-being.
And I think the state has a list of all CMHPs for Oregon, because not all CMHPs in Oregon are county entities. Some are contracted with the counties. So there is a list of, if you're wanting to reach out to find out about other advisory boards, because they are out there, that's for sure.
Is anybody in this meeting familiar with other counties' advisory boards?
I just Googled Multnomah counties and found their minutes, and they look very similar to us.
Do they?
In terms of county, local people show up, they present, they talk about events in the community. Again, it's their minutes. Guys, it's really short, so I don't really know the details, but it seems like we're a mix of things. There's little clauses that sound like there's committee work that they do, that they present, that we may need to find somebody to kind of bring in trust about how do you do that, what's it look like. And we could, but yeah, the local they have somebody connected to the county, and they've had multiple non-county based folks for the last 6 months of their meeting minutes give presentations in the middle of other things they do. So in terms of what Oregon's doing, it looks like that. Not that we need to copy that, Marty.
That's super. I think that's helpful. Just kind of, we don't need to reinvent the wheel here. Let's see what we can do. Paul?
Yeah, this is the third community mental health program that I've worked under. Marion was the first, starting in the 90s, and then Yamhill for a half a dozen years. And yeah, all three of the counties that I've served have had a behavioral health advisory board, and they've all operated in pretty similar ways. I would say that actually this board is the most robust of the three that I've participated with. I mean, and at least in terms of membership, and I think every board that I've been associated with has had similar kind of discussion to what you had earlier today about what's our purpose, what are the activities that we want to be engaged in moving forward. They have all seemed to struggle a bit with identity. So I mean, I think my perspective from seeing a few of these boards operate is that this board has opportunity to really thrive. So I just would invite you all to not, to be fearless about how you want to approach it, because you have the fodder for success.
So I feel like we might need to corral a little bit of this at this point, because I think we're all pretty much on the same page that we need a little bit, define our identity a little bit more and these priorities and strategies and whatnot. And I think we have a lot of discussion about this and some brainstorming, but also trying to do it in an organized fashion. And so I think because there's been a lot of turnover just in the last month or two, Lee and I need a chance to kibitz, and we need to meet with Holly and Dana and kind of get the logistics of this board figured out. But what I'm wondering, I guess one of the obstacles that I think we may have is these hour-and-a-half meetings for these big discussions. And I think an hour-and-a-half meeting is plenty good. I'm not suggesting we go longer than that on our monthly meetings, but I'm wondering, is there any interest in doing some kind of a retreat that's maybe a 4-hour type thing, so we can kind of hash some of these things out? And it would be on Lee and I to have that well organized and planned out, but so we can streamline these conversations and here's my style. I like to talk, but I also want to come out of a meeting with a deliverable. I'm just like, okay, what's my next action? That's how my brain functions. And so what I want to not do is just have this conversation persist for another 6, 7, 8 months while we find our way, knowing that there is some pre-work that Lee and I need to do to kind of get ourselves oriented. But is that something you guys would be interested in doing or willing to do?
I think one thing, I mean, yes, I like it. And those deeper, bigger conversations are super important. So 100%. I think we also have to be aware, some of us are parents or caregivers, family, we're not paid to do this. I fortunately work for an organization that believes in me being here. How would they feel about 4 hours? I'm not sure. So I think that's a consideration that has been in a lot of the parent kind of advisory boards they've been a part of, to consider what does that mean for people who aren't doing it on behalf of their work. So I don't have the answer. I'm just saying.
That's absolutely a good consideration.
Something to think about.
Oh, sorry. So I understand the idea of a retreat. I'm challenged too, because I work and I'm a parent and I'm on this board and I'm on that board and everything else. So I would like to say, I anticipate with you at the helm, who's very stay on time, that these meetings become more productive. And we've added 15 minutes to them. So I'd like to suggest that we see how it goes for the next couple months, get all these things in order that we need to do to identify who we are and our priorities, and then maybe bring on some new board members. And if at that point at another time we want to revisit the retreat. I don't know if I know what I would talk about for 4 hours at that retreat until we do all this other upfront work.
Fair enough. And I think, and my vision for that would only be that Lee and I would have to have a lot of pre-work to make it useful, because what I want to do is for those parents, my goal is, I feel like most of the last year that I've been on this board, I feel like I haven't been effective it hasn't been an effective use of my time, to be quite honest. Like, I feel like I hear a lot of stuff, but we're not doing a lot of stuff. And that's what I want to value, your time, and make sure that we're a good functioning board. So we're not just sitting here for an hour and a half, one Friday a month and not.
Sorry.
Somebody's a Duck fan. Anyway, that's kind of my intention. It's fine to not do a retreat. I hear you loud and clear.
I was just saying, public health, their advisory board meets, and they have like 2-hour retreats frequently. So we could do something like that, and they have it right at the county building. So I don't know.
Maybe we could lengthen our meetings every other time to 2 hours.
That would be more
Doable?
easily, yeah. I mean, I think 2 hours is a little more easy to manage, more easily manageable than 4-hour chunks.
Sure.
I'm just raising her hand back here, just in case.
Hold on, I see you, Linda. We've got 2 other people here, and
No
I want
worries.
to let Dana.
I can take my hand down. Okay.
Oh, let me go. Oh, go ahead, Dana. What'd you say?
I was just thinking too, at one point, we had made this meeting just for the board members, and kind of took like Deschutes County employees out of it. And maybe we could do something like that was a little bit more focused and extended that time to 2 hours. So we're not trying to take more time, just an extra 30 minutes. And so maybe we could just close off 1 month and use that as the retreat.
Okay. Linda?
Oh, thank you. If you don't mind, could we not use the word retreat? And the reason is when other people hear it, not always, they think that we're just getting together for fellowship and a picnic and whatever. And that can give a perception of it. I can't let you off work for that, or we're not going to pay you for that, yada, yada, yada. But I like to maybe us think of it as planning sessions, and we could have many planning sessions. You can have a planning session in 45 minutes and you pick one thing to decide and not a whole host of things. But I agree with our new chair. I'd like to see deliverables out of the meetings too. We've done things that are interesting, but again, I'm new. So I would really support short mini planning sessions and make one decision at a time. And we make one decision per meeting, and maybe we allow, what's the decision today? Do we have 20 words that define what behavioral health is for us? And we look at the state statutes, and that could be our first deliverable that to me would drive, in a perfect world, should drive everything else we do. Our resources, whether they're 10 minutes, 20 minutes, 5 minutes, printing a brochure. That's a little soapbox anyway.
So somebody else?
I was just going to say deliverables, and I think maybe I see them a little differently as a parent. I think there are multiple, and this goes back to who we are and what we do, but there's multiple deliverables, right? There could be advocacy letters, testimony, those deliverables. I think some of the deliverables, though, are going back to the sheriff's office, going back to IDD, going back to the behavioral health, staff that are here to say, hey, we've experienced this, or you're saying this, and that just does not go. So I think there have been deliverables, but I totally agree with you too, like these tangible things. I personally don't want to spend my time redefining behavioral health, though. I think we've got that covered. And I think there's statutes that tell us what we're supposed to do. If we want to reach out to folks to ask what they're doing, I think that's fine in other counties, but I think we should be our own, as Paul was saying. I mean, this county has always been forward thinking and been able to do great things. So I don't see why we can't also do that.
I agree. And I also really want to leave kind of the behavioral health expertise to folks in this room who are employees of the county. Not that we don't have our own professional expertise and lived experience as well. and I do really appreciate Melinda and Lee, us charging forward with moving away from the performative. And I think that's the danger with required boards. And so I just want to thank you for that.
Yes, thanks. I just
appreciate it.
we're all smart people and we're here for a reason. We care for whatever reason. So let's make us work good and, you know, feel good about the work that we're doing here.
We value your expertise, your advocacy, your time. It's really important that it's not performative and that just being a statute saying that we check the box. I mean, it's really important to hear directly from people in the community so we can continue to shape the work that we do and provide in the community. And also share with you what we might need, around advocacy.
Absolutely.
Right? And so we can partner together. I think it's really important. There might have been some messages in the chat, but I'm not positive.
I think they were from Shannon and I copied them for the notes.
Okay. I don't know what the idea as well as Kristen, but yeah, Kristen didn't.
Paul.
Just one other point in terms of urgency. Next week is the beginning of a long legislative session, and there are 2,300 some bills, I think, that have been introduced, and I don't know. I don't know how many of those are flagged as potentially, related to. I know about 25 to 30 are related to potentially to IDD. Don't know how many are related to behavioral health, but this committee might be really useful in terms of helping with advocacy in front of legislators, giving testimony or writing letters or that kind of thing. So just kind of wanted to put that out there.
Given the urgency on that, and I think that on all of these other bigger issues, I think really Lee and I need to have a talk because we haven't even talked before today. And then we need to meet with the county and kind of get oriented along with figuring out how to corral this and come up with some organization to approach this. But on that, because there's some urgency, I agree. I think we can be an effective source of advocacy, but how do we know what you need?
Yeah, that's a great question.
Like, I think there's people in this room, I'm included, that I'd be happy to march to Salem and give testimony or to write a letter on behalf of our board or individual letters. But I don't know, I mean, I'm tracking a lot of legislation for special education, but I'm not doing it for behavioral health as a larger thing. So who comes to us and say, Paul, maybe it's you, that you come to us and say, hey, it would be really helpful if you can get 3 people on the BHAB to come and either provide testimony or write letters or whatever. So we just need, that's the feedback that I think we need from the county.
Yeah, well, I think definitely put that on your agenda for when you and Lee have a discussion with Holly. She's pretty involved with following legislative action like I am on the DD side. So yeah, but that's exactly, Melinda, what we need is kind of a conduit for when we learn about a thing that needs testimony. It's way more powerful for somebody with lived experience, family member, way more than it is for a staff member of a behavioral health program, because it starts to sound like we're, trying to do something self-serving. Yeah. It's way more effective for a community member, a recipient of service to be giving that kind of testimony. So yeah, I think that's, from my perspective, that's what I would be looking for when I hear from a lobby, from our lobbyists through AOCMHP, hey, we need stories from community members. I want to have people that I know I could go to make that ask of.
Who's our lobbyist?
Northwest Public Affairs, I think both for IDD and behavioral health through AOCMHP.
Yeah. I'm sorry, go ahead, Danielle.
So I was just gonna say, yeah, so I spend a lot of time in this too, with behavioral health as well as medical, general health. But I think one thing we certainly could do is we could reach out to our local representatives and senator, all of which have definitely are supportive of more behavioral health in our region. And if we let them know who we are and that we are willing to testify, I can't tell you right off the top of my head if any of our local reps are co-sponsoring or sponsoring any pieces, any bills. Emerson's got a big, so, but she's very receptive, and every time I meet with these people, I do try to mention the Behavioral Health Advisory Board to say, if you ever need someone to talk about that, let us know. But we could be more direct too.
Do we have a list of the bills that have been introduced and who's sponsoring them?
Well,
And
like Paul said, there's over 2,000 right now, so I think they just came out on Monday. I've been trying to weed through them and there's a lot.
Holly
So-
probably has a radar list, right?
Probably, I would think Holly would have, or somebody would have a list of.
Yeah, and Danielle, she's even learned about law enforcement ones. I haven't even got into them yet.
Yeah, there's a ton of law
Yeah, but with that being said, it has just started. So the bills are coming.
It's a long session, so it's not like we need next week, but.
And I want to remind everybody, because when Holly gets back, she'll go over those bills. She did it last year, the year before. We'll go over and she'll tell us what she's concerned about, what she's not. But for this board, one of the things we have to remember is we're a land of plenty over the past couple of years. Everybody's looking at 15% cuts. So cuts are coming. And what does that mean? And generally with the first cuts come to behavioral health, the second cuts come to public health. And then the third cut, of course, within the sheriff's office and the budget. When it comes to big gun, we're the largest budgets. So I think we'll have to play on that. And when, our input to Holly will be very important, and to whoever the commissioner is that sits in here. So although we may think that we've not accomplished things, it is being heard by Patty. I hear her take her to the meeting. I go to those meetings and she talks about, I heard this at my BLL.
Good, okay.
So,
I feel like a responsibility to get more involved in that too and go to some of the commission meetings, but okay, bye Lorelei, thanks for coming. So I want to be mindful of our time and it's 1:10 right now, so we're a little bit over on the agenda. And I think the next steps is just Lee and I need to connect. We need to connect with Holly. We need to connect with Dana. We need to kind of come back and figure out a structure to talk about this so that it's not just going in a lot of different directions. But we do need to visit committee memberships because I am not going to be the chair and on membership and Lee and I are the committee members for the letters of support and advocacy. So I really would like to plead to you guys to please consider stepping forward, being on a committee, maybe two, because we're a little low on numbers right now. My view is that we need to prioritize membership because, and Cameron, I hear what you're saying too. I think it's hard to go out there and recruit when we're kind of still in this, but I also think that hearing from somebody from St. Charles might be a good thing. I mean, I think it's okay to join a board and that's evolving. That's evolving and being refreshed, if you will. And I do feel like we need some numbers in order to round out our committees and really think this through. So if we're talking about the membership committee, that really leaves Cameron and Peter on that committee. Do you feel like that's enough or do you want somebody else on that? Can one of you sort of take the lead? Because we do have a couple of potential board members and their materials that we need to get in your hands and have that drive forward.
I think it's always good to have three because two can be a tie. And I'm happy to take the lead for a bit, depending on how long this process is going, for a couple, right? But if we have like 8 interviews, that's pushing me over the top.
Well, by my count, we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well, 10, but Patty, I don't think is an actual.
She's not.
board
Yeah, we
member.
decided that last time.
She shouldn't be voting.
And then we've got Jill Adams hasn't been around much, so I don't know if she would need to contact her to see if she's still.
I tried contacting her twice. I haven't heard back.
When was the last meeting she attended? Do you know? Huh?
Is it this summer?
Sometime in the summer.
She did sign up for it was sometime during discussing subcommittees, which has only been in recent months because she did sign up for the community outreach.
Yeah.
And then I had a couple meetings, I think 2 different meetings at my house. Jessica was at them and she said she was coming and then she would no show. So, yeah.
So if my count of active members is accurate right now, there's 1, 2, 3, 4, 5, 6, 7, 8, not including Jill, and we'll find out Jill. And if if she wants to be active, then we've got 9. We're required under our bylaws to operate with 9, between 9 and I think 13 members, somewhere in there. So I don't think we need like this massive 8, don't need 8 people, but I think we could use 2 more people, and we have a couple applications, and maybe we just step into it. But I would love to see one more person join us. Maybe if Callie is interested, not Callie, Molly, sorry.
And she's a board member, Molly?
No, she's not, but she's from St. Charles that Christina had suggested. And I do think St. Charles is a very relevant organization to the work that we do.
Well, Molly's very dynamic. I really like working with her, and
She was at the county.
yeah, she was, and
Oh, yeah.
she's been around a lot of different places, very helpful and organized.
So is there anybody that would like to join Peter and Cameron on the membership onboarding committee?
Go ahead.
Stephanie?
Hi, yeah, this is Stephanie. And thank you for clarifying the number of members that we had. So right now, because that was one of my questions, is like what of the people who are online and those of you that are in the room, is this representative of our entire membership? Because it does seem like it's really light. And I know that we're missing some staff as well, and then obviously Commissioner Adair, but it feels like it's a really lightly attended meeting. So I was just curious if that's because of the members that we had lost. I used to be on the calendar committee and liaison with Jessica, and I don't know and I'm not on that anymore, and I don't know if that dissolved because we kind of finished one project and then maybe it just went away, and now Jessica's no longer a part of it. But I don't know that that's really actually a committee or a subcommittee that we need at this point. Maybe we do need to kind of focus on the membership. I'd be willing to be on the letters of support and advocacy as well, or the community outreach, but wherever there is a gap. But for sure,
If you would be willing to be on the membership committee with Cameron and Peter right now, I think that's the one. I think that we need to get going on that one, and that would be lovely. And you'd be the 3rd member, and Cameron will organize it, I think. And as far as the calendar stuff, my thought is, I don't know that we need a calendar committee. I think we just need people to tell Lee and I and Dana that there's an upcoming event. And then I think that it makes sense to have a agenda item on every meeting, upcoming events. And it's just a real quick 5-minute or maybe 2-minute where you just kind of go over so everybody's aware of what's coming up. And that way we don't have to staff a calendar committee when we're trying to prioritize membership, onboarding, and maybe community outreach and letters of support seems important to me. Although on the letters of support and advocacy, we might need to kind of get ourselves a little bit more organized.
I had also volunteered for that one quite a while ago, a couple months back, but I didn't see my name on there. So I'm happy to do that when needed.
All right.
I think the idea of the calendar, if I recall.
What?
On the calendar thing, I think a couple months ago, we even talked about similarly just point person and putting stuff on the county calendar accomplishes the requirements in the bylaws and on the boards or whatever the rules are we're under. That as long as we're putting stuff out there for when that met the need. At minimum, and I think the calendar could be something you and I and Dana and Holly solve rather easily moving forward, rather than committee processing and membership, and then the letters of support and outreach groups as sort of our legs of the stool.
All right, so crossing one item off the list, it looks like our membership committee is short up right now. And Dana, can you coordinate with Cameron to make sure she has the materials, the application materials, and the names of anybody that might be interested? Also onboarding packages, because once they're on the committee, that was one thing that I felt when I joined, it didn't have a lot of onboarding, and I think we need to kind of improve that. The applications, there's a packet of information that goes with that committee that we want to get into Cameron's hands. My suggestion is for our transitional age representative that we've spent some time on, quite a bit of time. We haven't had one applicant, and I think that we're in a transition period with this board. So I guess my preference would be we put that a little bit on the back burner while we're focusing on some other things.
Well, come up with a new name. I think that the name just scared people off.
Yes.
Motion to table that till next time.
Yes. Well, let's table it till.
Is that a
summer.
motion? Is that a motion? Do we have a second?
Really, we can just keep
A second.
motioning and signing. Motion to talk about that later.
Yeah. Okay, we got a motion. We got a second. Any further discussion?
I agree.
All right, we're gonna put it to a vote to table the transitional age representative effort and project until a later date. All those in favor?
Aye.
Any objections? Okay, thank you. Great motion. We can spend some time on that.
I'll stay on outreach for now.
Okay, and so we'll find out of Jill, what Jill's status is, because I've got her and Julie. All right, I think we're good. And
Linda's hands up.
Linda, where are you at?
When I came on board, I didn't find a list of all the current members, and of course that's changed, and who they are and where they're from. And I would like to have that information. It might be helpful for all of us, and maybe I'm the only one that doesn't have it. But then how do we know what our gaps are if we don't know what our current member coverage is? So
I thought that there was something with that because we have family members who are here on behalf of loved ones that didn't do something like that. I could be wrong, but I think I remember this discussion several years back.
Yeah, so Linda, I don't know if you heard Daniel make the point that it's a little bit of a sensitive situation, that to the extent we have family members here who are here because of their lived experience with their family members, there's some privacy and confidentiality concerns. But also, I know we have the onboarding packet that I got at some point that's welcome to the Deschutes County BHAB, basically, and it says meet the board. This just needs to be updated, and we can do that, but I think this is a good piece of information. And it says where everybody's from. Now, it could have some additional information. We could flesh that out and ask our new board members, what can you provide us with, a short bio statement? Why are you here? And then that lets them offer whatever they're comfortable with. Would that satisfy? Would that be okay, Linda? Does that serve?
well, my reason for wanting the information, I'm on the board and I might want to interact with people outside a meeting, and how do I reach them? And I guess number two, what functions are covered and what aren't covered? If we have gaps in function when we're recruiting new members, I think it would be really cool to recruit for the gaps, the knowledge or life experience gaps. If we have a choice of a lot of candidates. And for the family thing and the confidentiality thing, they could just put their initials and write the word family member, but we would understand the point of view that they're representing, so we would know where our knowledge and skill gaps are for this committee.
Yeah, we'll work on that. I don't know about putting the initials of the family members. I'm
just
tuned to that.
I don't care what their name is. I just want to know what gap, the knowledge gap that they're plugging. I mean, from a functional standpoint. So
Yeah, okay, that sounds good. So I think we just need to get to know each other better is what we're talking about, and identify the gaps, which I think we can do. All right, and in terms of, I think that's it. Anything else on committee membership?
So for community outreach, we have Julie and Jill. but
Jill.
she's question, so, okay. And then for letters of support, it's Lee and Danielle. Accurate?
Somebody else.
Lee, do you feel like?
I think Stephanie might have said.
I thought she got moved up to membership. Did you want to do both, Stephanie?
I could do, I definitely membership, and then community outreach or letters of support and advocacy, wherever the need is greatest.
Okay, Stephanie, I'm going to put you on letters of support, and I do think that it's probably going to be a fairly nice transition. So if we focus on membership for the next couple of months, and then we'll start ramping up on advocacy type efforts. And so I'm hoping it's not going to be too big of a burden to serve on two committees, given how we're sequencing this. Yeah. So anybody else interested in community outreach? Julie is a committee of one at the moment, and it'd be nice to have
I don't mind that. I mean, if somebody wants to join, I did pass that little thing around. I've got 1 minute and I passed this thing around and nobody did anything. Oh, somebody. Yay.
Didn't have pens and
That's okay.
it wasn't until over
So-
there that it got.
These are ideas. I've talked to Shepherd's House, the Lighthouse. They're having their grand reopening in February. We were invited to come. They were all excited about the board and who we are. And I said, yeah, we're not coming to the lunch and, buy a table. But I'm going to set something up for probably either late February, early March with them. And it's at the end of the day, like a 4:30 thing. I said, we'll probably have 2 or 3 people maybe. And we just want to keep it short and sweet, like 15 minutes where we get the quick tour, who you are, what your mission is, who you serve. And then I'll set those kinds of things up. And then if somebody thinks I'm on the wrong path with outreach and you guys see a different vision of outreach, then let me know and we can just kind of evolve this committee as well. But that's kind of what I'm doing for now. And then the expectation would be whoever goes out comes back and takes 3 or 4 minutes to say, here's who they are, here's what they do, so we'll learn some more.
One thing I'd love to, I keep hearing, and I experience this from my professional life as well, is, like Julie said, it took her a couple of years with her family member to try and figure out what resources are available. That's a high priority for me, is just working with the county and figuring out how we can help the community see the flow chart or whatever about here's some places that you can go, and getting that out in the community. So it's community outreach to partners, but also to the people that the county serves, like just trying to make sense of it all. And I'm still struggling with that. So is there anything else on committee memberships that you guys want to talk about or volunteer for? We'd love to have every member of this board be on at least one committee.
Jumping in, sorry, 1 minute. Would anybody be interested in having a guest speaker come in from NAMI who is living with mental illness successfully in the community, and what her story is or his? Because the NAMI people have said, I'll go out and I'll tell my story. I have no problem doing that. And would that be helpful to Deschutes County folks, or this, just to hear? And I promise to keep it short and sweet. Like, here's your story. You've got 10 minutes. What was the best part of your, help, and what were the worst barriers that you had maybe?
I think if it's connected to the Central Oregon region, like if it's somebody who's lived here and accessed services wherever and what their story was, it helps.
Yeah.
Otherwise, if they came from somewhere else, I'm like that, that tells me zero. But yeah, no, I think that, personally, I think that's great.
I think that's outreach too, okay.
And then it keeps the gate, it can start eroding the gatekeeping, finding access. Where do I start? I'm in a room with the director of the county. And we can find more lived experience people every so often. Yeah, it's a good start.
Yeah, Melinda, if you want to put me on outreach, I'm already meeting with many people, warm handoffs and all sorts of stuff.
So for community outreach for you, that would be great. Is that, yeah. And so we're not going to have a calendar committee. My recommendation on the letters of support and advocacy, let's just shorten that to advocacy.
Yeah.
Letters of support is a mechanism. Okay. All right, so I think we're going to move on. We're almost done here. We've got about 3 minutes to talk about agenda building, and I don't think that requires a lot of discussion. But if you guys have an agenda item to propose, just email me and Lee and Dana, and we'll get it on the agenda. Easy peasy.
Whenever you want to speak to the new sheriff, just let me know the date and time, and I'll put it on his calendar.
I would love to do that. Do you think that would, what do you think would be most effective? The whole board, or have him come talk to us, or just us to
Well,
go?
you could either come to our place and you can meet there, or have him come here. It might be better. If we want to couple it with, doing a jail tour or what have you. He's very proactive on these type of things. And so I think whatever you think's the best, he will. But when I came here, I said, hey, I'm probably going to offer you up to come.
What would be best for him? What would he prefer? Would he prefer it at the jail and then we tack a quick tour on, or would he prefer to come here?
Well, I think for him, it wouldn't matter. I think if you came to our building, it would kind of be fun. I like go see, right? Get out and go see. So maybe come over to our office if you've never been there. And 90% of everybody that lives in the jail, as you know, has either mental health or drug addiction issues. So it's going to be, for the people who are trying to help.
Can I set something up with you directly for the outreach for end of February?
Yeah, you
Okay.
just, whatever you want.
And then I'll kick the ministries down to March or something.
Okay. Is there anything else for the good of the order that you guys want us to know as we're kind of making this change? And
Just really thankful you both offered to do that. Appreciate it.
Yeah, thank you so much. I'm excited about the new year.
Yeah, I'm excited too.
New energy.
Yeah, that's great.
good. Well, hopefully we'll see some positive direction and give us, I guess I ask for your patience because there's a lot here. And so I think it's going to take us a couple of months to kind of put our arms around it and start chipping away at some of the things that we talked about. And yeah. So our next meeting is, when's it scheduled for, Dana?
The 21st.
Okay, February 21st.
Is that, that's not President's Day weekend, is it?
I think that's the weekend.
Oh, good, okay.
Yeah, the 17th.
Awesome.
So I think that for the next couple of months, we'll probably be focusing on internal structure stuff, not so much having speakers come in, just so we can get ourselves organized. And then we'll start getting, there's somebody that Dana has that would like to come talk to us. I am going to try, to the extent that we invite people to come speak to us, I'm really going to emphasize that you have 20 minutes or whatever the time period is that we put on the agenda, because we do have enough business this year that we have to leave ourselves some time for that, and it just takes time. So anyway, anything else?
Take some sandwiches with you.
Yeah. Minimum order.
Should I go see if we have, do we have more boxes?
Yes, I think we do.
We have some to-go boxes we'll grab. Yeah.
All right.
Salad, I'll eat some salad.
All right. This meeting is adjourned.